Today we are covering diabetes medications, a topic the NCLEX will absolutely test you on, primarily from a safety perspective. The most critical concept to master is the relationship between insulin peak times and the risk of hypoglycemia. The exam won't just ask you for the peak time of regular insulin. Instead, it will give you a scenario, such as a patient who received regular insulin at 7:30 a.m. and asks when the nurse should be most vigilant for sweating, shakiness, and confusion. You must know that regular insulin peaks in 2 to 4 hours, making the highest risk period between 9:30 a.m. and 11:30 a.m. This is the danger zone. For rapid-acting insulins like Lispro or Aspart, the peak is much faster, around 30 to 90 minutes. This is why it's given when the meal tray is right in front of the patient, not an hour before. The NCLEX loves to test this timing. Long-acting insulins like Glargine or Detemir are tricky because they have no significant peak, which is a key patient benefit, but also an exam point. The test might try to trick you by asking for the peak time of Lantus, with no peak being the correct answer. When it comes to mixing insulins, the exam requires you to know the exact procedure. You'll likely see a question asking for the correct order of steps for drawing up regular and NPH insulin. The key is to prevent contaminating the short-acting insulin with the long-acting one. A vital mnemonic to remember is clear before cloudy. You always draw up the clear, short-acting regular insulin before the cloudy, intermediate-acting NPH insulin. So you would inject air into the NPH vial, then inject air into the regular vial, draw up the regular, and then draw up the NPH. Never mix long-acting insulins with anything. Moving to oral agents. Metformin is a top-tier drug for the NCLEX. The number one safety issue is its potential to cause lactic acidosis, especially in patients with renal insufficiency. A classic exam scenario involves a patient taking metformin who is scheduled for a procedure involving IV contrast dye. You must know to hold the metformin before the procedure and for 48 hours after, until kidney function is confirmed. This is a huge safety point. Sulfonylureas, like glipizide, are also common, but their main exam trap is the high risk of hypoglycemia, particularly in elderly patients. Finally, let's talk about sick day rules. This is a favorite NCLEX topic because it's a common point of patient confusion. The exam will test your ability to educate a patient. The key takeaway is that the patient must not stop taking their insulin, even if they are not eating. Illness-related stress can raise blood glucose, so insulin is still needed. They should monitor their blood glucose more frequently, perhaps every 4 hours, and test for ketones in their urine. The nurse must instruct the patient to stay hydrated and to call their provider if their glucose remains high or if they have moderate to large ketones. For hypoglycemia recognition and treatment, if the patient is conscious and able to swallow, the priority is to give 15 grams of a simple carbohydrate, like 4 ounces of juice or regular soda. Wait 15 minutes, recheck blood glucose, and repeat if necessary. This 15-15 rule is a core nursing intervention you must know cold for the exam.